When I was first hired at Interval House of Hamilton, I was hired to provide continuous improvement, so make sure our services were responsive to women's needs, but also were forward-thinking. So when I first came, there was an opportunity to be a part of Dr. Harry McMillan's grant, if, when, and how to ask the question. It also led to a second research project that we were involved with, which was really looking at the education levels of healthcare providers. And what we found is, in the province of Ontario, we really need to do a much better job at consistent training around how to really work with women who've been abused. And then some other researcher support that we did is we worked with Dr. Mohit Bhandari around creating better responses in fractured clinics for women, and I think that we were really privileged to be a part of it. And then currently we're working on the Ontario Shelter Project, which is really looking into women's experiences of shelter, and also what do shelter workers and their executive directors think they do, and then what do the community think that shelters do, because we really think there's a disconnect. So in 2007, I was appointed by the then Minister, Sandra Pupatello, to chair the Ontario Domestic Violence Advisory Council to the government, in which we made 5 recommendations to improve services for women, which I'm very pleased to say that the government has taken on many of those. One of the areas that the government then put forth to change was creating a practice guide for those who are working in child welfare, which we were very pleased to be a part of, developing both the curriculum and the practice guideline. The government has also hosted a high-risk symposium for police services and allied other professionals to come together to really look at how do we develop high-risk teams for community. I am so proud of Interval House in that I think that we have accomplished tons of things over the last 5 years.